Now answer to question 151 is option, the feature of anancastic personality disorder. The answer is B, rigidity and stubbornness. Now let us discuss about the personality disorders. Now personality disorders are the enduring pattern of behavior and inner experiences. They usually have onset in the adolescence or early adulthood, and they are stable through time. And 2 out of the 4 domains areas which are affected include the cognition, interpersonal relations, impulse control, and affect. So 2 or more areas these may be affected. Now DSM classifies the personality disorders into 3 clusters: cluster A, cluster B, and cluster C. Now cluster A has a group characteristic of being odd, aloof, odd and aloof. Now these include paranoid personality disorder, schizoid, and schizotypal personality disorders. Now cluster B has a characteristic of being dramatic or impulsive or erratic behavior. Now these include antisocial personality disorder, then borderline personality disorder, then histrionic personality disorder, and narcissistic personality disorder. Now cluster C include anxious, fearful features. These include avoidant personality, then anxious or obsessive compulsive personality disorder. Now obsessive compulsive personality disorder in ICD-10 is known as anancastic personality disorder, which is characterized by, now these are characterized by at least 4 or more of the following features. Now these features include preoccupation with rules, details, order, and in so much so that the major point of the activity may be lost. Then perfection that interferes with the task in hand. So they will be trying to be perfect, but so much so that they will interfere in the task which they are doing. Then there is also excessive devotion to work, so much so that there will be exclusion of leisure activity. Then they will be inflexible in matters of values and morality. Then also they will be unable to discard unworthy or the worthless objects. They will be unable to discard worthless objects, and then they also will have difficulty to work in team. Then also they may hoard money, and there may be rigidity and stubbornness present. So these are some of the important characteristic of anancastic personality or obsessive compulsive personality disorders. Now let us discuss the next question. Now flooding is a type of behavior therapy which is used in treatment of, the correct answer is A, phobia. Now phobias are irrational, excessive fear of specific object, situation or circumstances. Now, treatment of phobia, generally the non-pharmacological management is the treatment of choice. Now first is the behavior therapy. Now this is the most studied and most effective, and the first behavior therapy or the most commonly used is the systematic desensitization. Now this was given by Joseph Wolf. Now it is based on the principle of counter conditioning. There is conditioning developed of a particular object's circumstances or situation. So now we are counter conditioning the feared object. So it involves 3 steps. First is the relaxation technique. Then there is hierarchy construction, that is from the least anxiety situation to the most anxiety situation, you build a hierarchy. For example, a person is fearful of snakes, so the first least anxiety situation may be when the person is imagining that there is a snake. Then desensitization of stimulus. The person is made to move from the least anxiety situation to the most anxiety situation in a relaxed state. So these are the 3 steps involved. Now second important behavior therapy is the therapeutic graded exposure. Now it is similar to systematic desensitization, except that there is no relaxation technique involved. So there is exposure in graded manner according to the hierarchy. Now third is the flooding, also known as implosion. Now it is similar to graded exposure, in which the person is exposed, we expose the patient to fear object in vivo, in real situation, but again there is no hierarchy. no hierarchy. Now a variant of it, a variant of flooding is known as imaginal flooding. Rather than in vivo, in imagination, we are flooding the patient. And the patient, in this flooding, the patient is not allowed to escape. So these are the important behavior therapies used for phobias. Now let us discuss the next question. Question 153. The correct answer is B, common in males. It is usually common in females. So let us discuss the next question about bulimia nervosa. Now, eating disorders are of two types, majorly two types: anorexia nervosa and bulimia nervosa. Bulimia is from the Greek word which means ox hunger, and nervosa is nervous in origin. Now let us discuss about bulimia nervosa. Now it includes episodes of binge eating combined with inappropriate ways of stopping weight gain. Now this is that binge eating is there with it is combined with inappropriate way of stopping the weight gain. Now it is more prevalent than anorexia nervosa. Then onset is later in adolescence than that of anorexia nervosa. Now it is more common in females than males, which is again important to remember. Then often the women have normal weight and may even sometimes may have obesity, unlike anorexia nervosa where they may be underweight. So this is important to remember. Then the compulsory behavior for weight loss may include self-induced vomiting, then misuse of laxatives, diuretics, and third, fasting, and then maybe excessive exercise. Now during self-induced vomiting, the person knuckles of the hand may come in contact with the incisor teeth, subsequently producing callus formation, which is known as Russell's sign. Important sign. Then also when we see mortality, in mortality there are higher chances of recovery bulimia nervosa, and the mortality rate is around 2% per decade. While in anorexia nervosa, the mortality may be as high as 7%. So generally has a lower mortality. Bulimia nervosa has a lower mortality and higher chances of recovery. Now let us discuss the next question. So answer to this question 154 is option B, stage 2. Sleep spindle and K complexes, these are seen in stage N2 of the sleep cycle. Now let us discuss about the sleep. So we will discuss about question 154. Answer is B. Now sleep is scored in epochs of 30 seconds and studied under EEG, that is electroencephalogram, electroocculogram and electromyography. These three things are studied. Now in the wakeful stage, or let us say stage W, the EEG so EEG is a low voltage fast activity. Electroocculogram shows voluntary eye movements and the electromyogram shows tonic activity. Now when the eyes are closed, so it has, if we see, it has activity like, now when the eyes are closed, that is, there is preparation of sleep, so we may see alpha waves of 8 to 13 Hz, especially in the occipital region. Such graph may be seen. Now the NREM stage, that is the non-rapid eye movement stage, it's divided into again 3 stages, N1, N2 and N3. Now in the stage 1, previously known as stage 1, that is now N1, there is loss of alpha wave. Then there is also on EEG low voltage mixed frequency waves in the C with predominant theta waves, that is with frequencies 4 to 7 Hz may be seen, and also there may be occasional vertex, the sharp waves may be seen, like there may be sharp V waves may be seen. Now electroocculogram in N1 generally will show slow eye movement, and electromyogram may show skeletal muscle relaxation. Now stage N2, earlier it was known as stage 2, now it will show in EEG sleep spindle with 11 to 16 Hz frequency more than equal to 0.5 seconds, and there may be K complexes. K complex may be seen, which are high amplitude negative sharp wave which is followed by a positive wave. So let us just describe the EEG may look like. There may be a negative wave followed by a positive and a negative wave, and then there may be sleep spindles. So these are the K complexes and the sleep spindles may be seen. Now in the stage 2, the electrooculogram will show no activity and EMG may show low tonic activity. Now N3, it combines the previous stage 3 and stage 4, while now it is now known as stage N3. Now this is also known as the stage of deep sleep or the slow wave sleep. So it is the deep sleep or the slow wave sleep. Here the EEG will show slow waves of 0.5 to 2 Hz frequency known as the delta waves. So there will be slow waves on EEG. There will be slow waves. There will be high amplitude slow waves may be seen, and EOG electrooculogram will show no activity and EMG may show low tonic activity. Now then the REM sleep. Now REM sleep, also known as the previously R stage. Now it may occur in 2 stages. There may be one tonic or persistent persistent aspect. There may be serrated waves which are also known as sawtooth waves with frequency of 2 to 6 Hz, and there may be another component as the phasic component which will show bursts of REM and muscle twitches. So this is again an important EEG finding in the REM sleep. Now the next question, there is a case of alopecia, and it seems like diagnosis is trichotillomania or hair pulling. So which of the treatment will not be done? So the answer would be C, electroconvulsive therapy. This will not be the treatment modality. Now let us discuss few things about 155, trichotillomania. Or the hair pulling disorder. Now in DSM-5, as we had mentioned, it is now under OC and related disorders. Now the term trichotillomania was given by a French dermatologist known as Francois Halopiu. So he coined the term. Francois Halopiu. Now it is characterized by an increased tension prior to hair pulling, and there is relief of tension or gratification after pulling the hair. So this is how it is characterized. Now most common area involved is the scalp area. Then other areas may be eyebrows, eyelashes, beard, trunk, armpits, and even the pubic area may be involved. The most common is the scalp area. Now treatment include drugs SSRI. Now it may be combined with pimozide, which is a first generation antipsychotic. Other drugs may include venlafaxine, naltrexone. They are also being tried. Lithium is also tried. Then there may be behavior therapy, although also clipping of the hairs may be used, and other behavioral therapies like biofeedback, then self monitoring, desensitization, and habit reversal. Now, behavior therapies like biofeedback, self-monitoring, then desensitization and habit reversal, they may be used. So now let us discuss the next question. The procedure shown in the figure should be used for all of the following except the correct answer of 156 is option D. It should not be used for. So the answer to 156 is D. Now the procedure here described is electroconvulsive therapy or the ECT. Now there are new treatment modalities. For psychiatric illnesses, two types: non-invasive and invasive. Now in the non-invasive, it may be electrical and magnetic. So the electrical includes ECT, electroconvulsive therapy, and transcranial direct current stimulation, and magnetic includes repetitive transcranial magnetic stimulation. Now invasive techniques may involve vagal nerve stimulation, then deep brain stimulation, and then cortical brain stimulation. So these may be the important, which may be especially we should at least know about the, maybe you may have expected new questions regarding these techniques, especially repetitive transcranial magnetic stimulation. You may have few questions regarding the same. Now let us discuss about ECT. Now ECT, there is electric current used to induce seizure. Now the modern ECT machines used are basically brief pulse waveform. Now they, according to the position of the electrode, they may be by frontotemporal, then by frontal, and right unilateral ECT. The by ones are generally more effective but more side effects, so a right unilateral may have less side effects. Now they are generally given at 2 to 3 times in a week. Now general important indications in ECT Now, important indications include in major depressive disorder, in suicidal patients, in severe or psychotic symptoms are there, then failed or intolerable treatment. Then again in pregnancy, it is a treatment of choice for depression with suicide in female who require treatment and they generally cannot take treatment, or it may be the treatment may be harmful to the fetus. So in such cases it becomes the treatment of choice, ECT, the treatment of choice. Now in the second important indications, schizophrenia, especially catatonic schizophrenia, then in manic episode when there is dangerous level of exhaustion have reached and you require to immediately or curtail down the symptoms, then there may be other indications including obsessive compulsive disorder, then neuroleptic malignant syndrome, then certain medical conditions it may be used like intractable seizures, it may be used. Now, so it is not generally effective or useful for, it is not used for disorders like personality disorders, somatoform disorders, then dissociative disorders. So generally it is not an indication to be used in such disorders. Now, in which condition the following type of brainwave, as we had discussed, it is a frequency, it is a low, it seems like a low frequency wave, and as we have seen that it is seen in deep sleep, that is N3 of the NREM which we had discussed. So answer question 157 is D. Now let us discuss now the damage to which part of the area, Marcia-Farber-Bignami syndrome. The correct answer is A. A is the corpus callosum area. Again, important such questions may be asked, visual based questions. So the answer is A. It is the corpus callosum. Now in the Marcia-Farber-Bignami syndrome, now it is a rare idiopathic syndrome, a rare syndrome which is characterized by dementia, seizure, ataxia. These they may be seen and generally initially described in male Italian drinkers. Drinkers who would consume red wine. Now here the etiology is that there is degeneration of the corpus callosum, and also there is an important sign known as the sandwich sign seen in radiological imaging. It is which is due to the involvement of the central layers of the corpus callosum, as if the central layer is sandwiched between the other two layers. So it is an important sign which is seen in Marcia-Farber-Bignami syndrome. Now this option 159, again an important question. Now this is a RTMS, or the repetitive transcranial magnetic stimulation. The answer of the 159 is the option A, as we discussed. Now let us discuss in brief about this technique. So this is again a non-invasive technique. Answer is A, RTMS. Now it was first described by Anthony Becher. Now the principle behind this technique is that the rapidly changing magnetic field leads to production of small currents known as eddy currents. Now, since the magnetic field is unaffected by the electrical so it is the magnetic field is not affected by the electrical impedance of the scalp and skull, so even the small areas of the brain may be stimulated, or there is focal stimulation is possible. So it is a non-invasive technique. Now, unlike ECT, no anesthesia is required, so this is again a plus point. Now, one of the important serious side effect of RTMS is the unintended seizure, which may be because of repetitive procedure or higher dose, or if there is an underlying brain condition. Now, the indication is for using RTMS is in depression, who have failed one or more of the antidepressant trial, or there are unwanted side effects. In such conditions, we can use RTMS. Now, contraindications for ECT. Now, important contraindication, although there are no particular, generally there is no particular contraindications for ECT, but 160 no particular contraindications or there is no absolute contraindications for ECT, but some of the relative contraindications may be recent history of stroke, then space occupying lesions, increased cerebral fluid, then retinal detachment. These are some of the important recent history of MI. These are some of the important relative contraindications for ECT. Now, also there is in ECT there is a term known as prolonged seizure, when the seizure duration is more than 180 seconds. So this is known as prolonged seizure. Now, vagus nerve stimulation is used in resistant 161 resistant depression. So 161, the answer is C, resistant depression. Now, let us discuss few important things about vagus nerve stimulation. Now, vagus nerve stimulation, there is a direct, intermittent electrical stimulation of the left cervical vagal nerve. This is via a implanted pulse generator. There is a pulse generator on the left side of the chest wall, and the electrode is wrapped around the left cervical vagal nerve. So it intermittently directly stimulates the vagus nerve. So what is the principle of the mechanism of action? How is it leading to this? So mechanism of action is the left vagal fibers around it, they are generally efferent. 80% will go upwards, and they basically change the activity of the brainstem nuclei. Mostly nuclei is like the nucleus tractus solitarius or the Raphe nuclei. Subsequently, this will alter the serotonin activity, and hence they will be effective in depression. Now it is approved, FDA approved, for various conditions including epilepsy, sequelae to neurological syndrome. Then in adjunctive, as an adjunct treatment of chronic or recurrent depression who have no adequate response to more than or 4 equal antidepressants, or that is treatment resistant depression cases, so it may be used, but generally they should be used only with age more than 18 years. Now, which of the following is seen in the stage E? Now we need to identify what is stage E. As we had discussed the sawtoothed appearance of the EEG, so it is the REM stage. So the answer to this question will then become option D, that is nightmares. So this stage REM will be characterized by nightmares. So let us discuss in briefly question 162 about the NREM and the REM sleep. REM also known as the orthodox sleep, REM known as paradoxical sleep. Now, the brain activity in NREM is generally lower than the awake one, and in REM it is increased, except that their muscle tone is decreased or there is muscle paralysis. So brain activity, then the body movement, they are generally involuntary and episodic. There is paralysis of skeletal muscles here. Then penile erection is absent while it is present in the REM sleep. Now dream are not remembered, so you can remember it as NREM is the dreams are not remembered, and REM the dreams are remembered. So various disorders or various syndromes seen in NREM as well as REM. So in NREM you may see somnambulism, somniloquy, then night terror, bruxism, and nocturnal enuresis. While in REM you may see nightmares, narcolepsy, sleep apnea, then REM related REM sleep behavioral disorders, they may be seen. So this is important to remember the various disorders seen in both REM and NREM sleep. Now answer to 168, as we had already discussed that there is in bulimia nervosa there is self-induced vomiting, so it also is in fact may lead to dental caries and enamel loss, as the acidic part from the stomach may destroy the enamel, or they may produce dental caries. So the condition described may be seen because of bulimia nervosa in answer 163. Now 164, as we had already discussed the Russell sign seen in bulimia nervosa. The knuckles, there is callousing of the knuckles, so this may be seen in bulimia nervosa. Now let us discuss the question 165. Now the answer to question 165, that is the transvestic fetishism, it is D, that is affected individuals are aroused when dressed as women. Now these come under the categories of paraphilias or the perversions. Now what are these paraphilias or perversions? Now basically there are sexual stimuli or the acts that are deviations from normal sexual behavior but are necessary for some, necessary for some to experience orgasm or arousal. Now fetishism here, the sexual focus is on objects that are intimately associated with human body, for example gloves or shoes, or on non-genital body parts. This is also known as partialism. While transvestism which was previously known as transvestic fetishism, here the fantasies and sexual urges to dress in opposite gender clothes, and subsequently it leads to arousal. So hence the answer is transvestic fetishism. Now let us discuss the next question. Now identify the schizophrenia shown in the photograph. Now the correct answer of this is Van Gogh syndrome. Now as it was seen by the great Van Gogh, basically there was self-mutilating behavior seen in that schizophrenia. So it is also termed as Van Gogh syndrome. As you can see, there is mutilation of the earlobes. Hence the answer to 166 is option B, that is Van Gogh syndrome. Now important, the next question 167, the father of modern psychiatry, the correct answer is John Weir. Now let us discuss few important names associated with psychiatry. So question 167. So the correct answer is B. Now the father of modern psychiatry. John Weir is the first to, he was the first to publicly, who was the first to in fact publish against the witch burning. Now previously people would burn people with saying that the person with mental illness is a witch, and they would burn such person. So he was the first one to publish against it. Now also sometimes Philip Pinel also Philip Pinel is also sometimes regarded as the father of modern psychiatry, and he was the first one to say to release mentally ill person from chains. So if this is not the option, then Philip Pinel may be also be the, you may mark as the father of modern psychiatry. Then let us discuss some other eminent people. Father of psychoanalysis, as we had discussed, Sigmund Freud. Then father of American psychiatry, Benjamin Rush. Then father of behaviorism, John B. Watson. Then father of Indian psychiatry, Dr. Vidyasagar. Now, the term psychiatry was coined by Johann Christian Riehl. Maybe asked as an MCQ. Now, agoraphobia is the fear of crowds. The answer is B. So option 168, the right answer is B. Now, agoraphobia is derived from the word agora, which means marketplace. Now, agoraphobia may be described as anxiety restricted to two or more of the following situations, which include in crowds, public places, then traveling away from home, and fourth is traveling alone. So two or more of the following situations, the anxiety restricted to these situations, this is known as agoraphobia. Now, medications of choice for the initial treatment of long-standing include all of the following. Generally, if it is said that we don't use 169, it will be, answer is D, diazepam, as benzodiazepines are only used for a short term till the time the other medications start having their actions, and there is generally an initial symptom management, but they are not used as long term because they have a abuse potential. The person may become addictive to these drugs, so we only use for short term. So diazepam is the answer. Now, which of the following is a rave drug? Now again important question, 170. Now there are club drugs. Correct answer is C, ecstasy. Now club drugs are the drugs which are associated with dance pubs, bars, or all night dance parties. All-night dance parties, which are actually known as rave. So these drugs are also known as rave drugs. Now, important drugs which described under rave drugs are the LSD, lysergic acid diethylamide. Then there is gamma hydroxy butyrate or GHB. Then ketamine, then there is methamphetamine, then MDMA, and then there is ropipnol or roofies, or that is flunitrazepam. So these are the drugs considered under. Also drugs, that is gamma hydroxybutyrate, ketamine and ropipnol, these three are also termed as date rape drugs because of they produce disorientation and sedation effects. So these three are also known as date rape drugs. Now adverse effects of carbamazepine include aplastic anemia. Correct answer is 171 is A. Now carbamazepine is used for treatment of trigeminal neuralgia, then for temporal lobe epilepsy or complex partial seizures, and also for acute mania. Now adverse reactions include mild GI complaints, then CNS complaints like ataxia and drowsiness. These are the most common complaints. Then other include blood dyscrasias, including aplastic anemia and agranulocytosis. Hence, because of this, they should never be used with clozapine, because clozapine also causes agranulocytosis, as we discussed. Then it may cause hepatitis. Then dermatological conditions, benign rash may be there, or they may even cause serious conditions like exfoliative dermatitis, then Stevens-Johnson syndrome, then there may be toxic epidermal necrolysis, and there may be erythema multiforme. These dermatological conditions may be seen. Then there may be renal effects in the form of hyponatremia or water intoxication. Then there may be other, although it may have teratogenic effect in the form of cleft palate, fingernail hypoplasia, spina bifida. That is, it may also cause neural tube defect, microcephaly. But the better answer, as we have neural tube defect also in the option, the better answer would be aplastic anemia. Now, commonly used in 172 in narcolepsy, the correct answer is option D, thiopentone. Narcolepsy, also known as narcosynthesis, it is used to procure vital information. Now, under controlled administration, there is controlled administration of IV hypnotic drugs are there. So, two important drugs used are the sodium thiopentone, also known as sodium pentothal, and also sodium amytal or amobarbital. So these are important drugs which are used. Now, panic disorder involves all of the following except. Now, question 173. The answer given B is actually wrong here. It is not in fact GABA, but actually the correct answer here C is C. This is not seen. The glutamate is the correct answer, that it is not seen. Now, panic disorder, these are recurrent unexpected panic attacks. Recurrent unexpected panic attacks are there. Now, there are certain Now the neurotransmitters which are involved in panic disorder includes norepinephrine, serotonin and GABA. So these are the three most important neurotransmitters which are involved in the panic attacks. So the answer is that glutamate is not involved. Now defense mechanism 174 used by the addicts is D, that is denial. Now defense mechanism is the function of the ego. These are certain techniques which the ego uses to curb or curtail the anxiety which is produced, and which is here with the ego is not able to otherwise deal with the anxiety, so it uses various techniques known as defense mechanisms. This concept was given by Sigmund Freud. Now there are, according to the George Valiant classification, there are 4 types of defense mechanism. First is the narcissistic defense mechanism, then immature, then neurotic, and then the mature defense. Now in substance use, one of the narcissistic defense, denial, may be used by the person in which he may say that he does not have any problem, he denies the reality. Or one of the neurotic defenses like rationalization may also be used by the substance user, saying, giving rationalization, trying to give some rational explanation to his, to justify his beliefs or behavior. He or she may give some try to give some rational explanation. So these are 2 important defense mechanisms used by the substance use disorder person. Now again, now DSM-5, in question 175, the axis 5 is used for option C, that is global assessment of functions. So it was actually DSM-4 which gave a multi-axis diagnosis, which is in fact removed. It is removed in DSM-5. So what were the 5 axes given? We may remember it as from the hand fingers. The thumb represents axis 1, which is the major psychiatric disorders. Then second is the finger, we generally use to point others, so personality disorders and mental retardation. Then the middle finger is the medical conditions. Then fourth, as we know, is the ring finger. So ring finger, generally in marriage we use ring finger to put the ring. So it is environment. It explains axis 4, the environmental and the psychosocial factors. Now for urination we just use the little finger. So for functioning, that is the global assessment of function, that is the axis 5. So it's an easy way of remembering. So, and it is scored, global assessment of functioning is scored from 1 to 100. So this is the multi-axial system in DSM-4, which is now removed from DSM-5. Now coming to the next question, question 176, suffering from which in the National Trust Act? The correct answer is option D, 176. That is mental retardation. Now the National Trust Act 1999, its complete name is the National Trust for Welfare of person with autism, cerebral palsy, mental retardation and multiple disabilities act. So this is the name of the act, National Trust for Welfare of Person with Autism, Cerebral Palsy, Mental Retardation and Multiple Disability Act 1999. So these are the conditions covered in this act. Now there is another important act which came, was the Persons with Disability Act 1995, which has 7 disabilities. One of them was mental illness. Now it is replaced by the newer act. Again important to remember this, the RP, Rights of Persons with Disability Act. Rights of Persons with Disability Act, that is 2016. Here the number of disabilities have been increased from 7 to 21, and disabilities related to psychiatric illnesses include autism spectrum disorders, intellectual disabilities, then mental illness and specific learning disabilities. Now important to remember these 4 at least in the 21 disabilities. So Rights of Person with Disability Act. Now answered, Mental Health Act came into in the year 1987. So question 177, the correct answer is option B. Now before that there was Indian Lunacy Act which came in 1912, then came the Mental Health Act in 1987. Now again prospective new question could be that since there is a Mental Health Care Act 2017, recently the bill became the act. So few important points to remember in this act is there is decriminalization of suicide here, then there is also banned ECT in minors and without anesthesia, that is now only modified ECT can be used, banned any kind of chaining of the person with illnesses. Then there is few important terms added is the advanced directive. Here that is the person with mental illness may wish to be cared. It is the advanced directive. It is the way person with mental illness wishes to be cared. Then also nominative representative, that is the person may tell who he or she may nominate so to take decisions for the treatment or for him during the course of illness when his capacity may be impaired or he may be not able to take the right decision during the illness. So he may nominate someone known as nominative representative. Two of the important sections you may remember is section 86 of the Act, which is for the independent admission, section 89 for the supported admission. Previously in MHA 1987 this was supported admission was called as involuntary admission, now it is known as supported admission. So these two important sections may be remembered. Now consultation license psychiatry. Now answer to question 178 is the psychiatric illness in medical ill, that is option A. Now CL psychiatry The term licensed psychiatry was given by Edward Billings. CL psychiatry is actually the area of clinical psychiatry that involves clinical teaching and research purposes, on other activities of psychiatrist in a non-psychiatric division of the hospital, that is psychiatric illnesses and otherwise medical ill patient. Medical ill person may also have psychiatric symptoms and illnesses, so consultation licensed psychiatry deals with this. Now, which of the following is not a side effect of olanzapine? Now, olanzapine, as we have already know that anhedonia can be caused by antipsychotic, that is the negative symptom. Then tardive dyskinesia we already discussed, again akathisia. Now, in fact, olanzapine causes mydriasis rather than meiosis. So, the correct answer is C, meiosis. Now, the question 180, which of the following phase 3 of psychiatric interview is? The correct answer here is B, that is history and database. Now, there are basically 5 phases of psychiatric interview which in their answers you may find. So, here the phase 3 is actually the phase of history and database collection. So, it is basically 15 topics are divided into 5 phases, and phase 3 is the history and database. So, the answer for 180 is option B. Now, subcortical dementia is seen in all except, so here the correct answer is 181 is option B. Now, cortical and subcortical dementia. The cortical dementia, generally the areas of the cortex are involved. Here the subcortical gray matter and rostral brainstem may be involved. Now, in the subcortical dementia, generally the motor system is normal, but here there may be motor signs and signs may be seen like dysarthria, tremors, dystonia, abnormal posturing because of the involvement of the subcortical regions. Now, important examples in this include Alzheimer's disease, Pick's disease, while here some of the important includes Parkinson's disease, progressive supranuclear the PSP, then Wilson's disease, then multiple sclerosis, HIV related dementia. These are the important. Now, which of the following may induce psychosis? As we had already discussed in the dopamine hypothesis, one of the hypotheses, point favoring hypothesis, were certain drugs like dopamine, like amphetamine or cocaine, which may induce symptoms suggestive of psychosis because they increase dopamine in the brain. So, the correct answer for 182, is option D, that is amphetamines. Now, activities of daily living to MR can be taught by. So, the correct answer of 183 is option D, that is contingency management. Now, few important points to remember about mental retardation, that it is now the new term used is the intellectual disability. Now, it is the limitation of both intellectual functioning as well as the adaptive behaviors, and that emerge in less than 18 years of age. Now, IQ, on the basis of IQ, said it should be less than 70. Now, it may be classified as mild, moderate, severe and profound. Now, mild may be from 50 to 69, IQ 60 to 69, then moderate is 35 to 49, severe is from 20 to 34 and less than 20 is profound. But DSM-5 states that IQ may not be required for diagnosing intellectual disability. Only according to the various domains like functioning domains, social domains, we can also diagnose intellectual disability. Now, contingency management is used. Here the principle is that the consequence of a behavior is contingent, that is dependent on the consequence of a behavior is contingent on the action done in a particular way. That is, what will be the consequence will depend on the action done in a particular way. So this is made contingent. So an important example of contingent management is the token economy. Now this is used while all the other important options given need good level of cognition, which may not be found in a person with mental retardation. So the correct answer is answer D. Now the symbol used in the photograph describes important MCQ for visual image. The answer is D, that is autism. So the answer for 184 is option D, autism. Now autism, it was previously known as, now in DSM-5 it is described under autism spectrum disorder, ASD, while previously it was known as pervasive developmental disorders. Now these are group of neurodevelopmental disorders characterized by impairment in social communication and repetitive and restrictive behaviors. So these are two important core features of ASD, autism spectrum disorder. The various disorders described in DSM-5 and ASD include autistic disorder, Asperger's disease, then childhood disintegrative disorder, also known as Heller's syndrome, then Rett syndrome, and PDD not otherwise specified. So these are the 5 disorders which are explained in autism spectrum disorder. Now the relevance of the symbol, that there are puzzles pattern, the relevance is that it explains the complexity of ASD. The different colors and shapes used, it shows the diversity of the autism spectrum. Then also the brightness of the colors, they signal hope. So this is how the symbol of autism may be explained. Now let us discuss the next question. Now a 6-year-old boy has been diagnosed with ADHD, started on methylphenidate. Which is a side effect should warn parents about? Is about, so the correct here, the answer may be so the correct answer here, in fact the 2 correct answers are there in this option. There is but B, that the cardiac conduction defects may more than A. So the answer may be given A as the right one, but the correct answer should be B, more than A. Now ADHD, let us discuss few things about ADHD. Now ADHD again is a neurodevelopmental disorder, and it is characterized by inattention, hyperactivity, impulsivity in at least 2 or more settings. Now it is seen more in boys than in girls. The ratio may be 2:1 to even 9:1. So it is predominantly seen mostly in boys. Now the first symptom to remit in ADHD is hyperactivity. Last is the inattention. This is the last to remit, again important MCQ. Now pharmacological management is the first line of management. In this, CNS stimulants are the first line, but they are contraindicated in children with cardiac risks and abnormality. The CNS stimulants which may be used are methylphenidate and amphetamine. Now it is a dopamine agonist. Initial side effect may be headache, stomach ache, insomnia. There may be rebound effects. Important, it may exacerbates tics, and also potential growth suppression may be seen. So it is methylphenidate. Then amphetamine may also be used. Now then other class of drugs are the non-stimulants, which include atomoxetine, then alpha-2 agonist including clonidine or guanfacine. Now all these above are FDA approved drugs, while the third drug, bupropion, is not a FDA approved, but it may be used. Also the alpha-2 agonists, they especially may be used in child who has tics, as they may also help in the improvement in tics. So if child with tics, we may use clonidine especially. So this was about this. Now next, 186, a man feels his nose is long, his family members and friends feels otherwise, and he has consulted many plastic surgeons, but none of them had made any modifications. But what is he suffering from? So he has been convinced otherwise, but he still is not able to be convinced. So the correct answer for this is option B, that is delusional disorder. Important is B, delusional disorder. Now it is a delusion disorder with somatic symptoms, also known as monosymptomatic hypochondriacal psychosis. Now it is of 3 types. First is delusion of infestation or parasitosis, that is body is being infested by worms and parasites. Then second is delusion of dysmorphophobia, that is the person reports of misshapeness or personal ugliness or exacerbated size or body, and it is up to a delusional level. Then there is delusion of foul body odor or halitosis, also known as olfactory reference syndrome. Here the person is preoccupied that there is some body odor coming from the body, and which is not able, other people are not able to appreciate it. So it also known as olfactory reference syndrome. Now other than this, a close differential to the answer may have been body dysmorphic disorder, but again even in this question it is not up to the delusional level. So the correct answer is delusional disorders. Now Now the 187 question. A girl, 20-year girl with complaints of pain in the legs, headache, but her physical symptoms are normal. So what is the most now? Again in this, the correct answer would be somatoform pain disorder, in which there is complaints of pain but there is no evidence on examination as we discussed in the somatoform disorders. So the correct answer will be somatoform pain disorder. Now, so question 186, the 187, the answer is C. Now, in question 188, the following are psychosomatic disorder except. Now, the correct answer here is C, cirrhosis. As we have discussed, now in question 188, and again we have previously discussed in the somatoform disorders, the one of the heading was the psychological factors affecting other medical conditions. For this diagnosis, there has to be presence of a medical symptom or illness, and subsequently psychological and behavioral factors adversely affect the medical condition. So various important illnesses include, like in GIT, irritable bowel syndrome, ulcerative colitis, Crohn's disease, peptic ulcer. Then CVS may include type A personality, then cardiac arrhythmia, then hypertension, vasovagal attack or vasovagal syncope. Then the respiratory system may include asthma and hyperventilation syndrome, COPD. Then endocrine may be hypo or hyperthyroidism. Then Cushing's. Then there may be fifth, dermatological conditions may be there, like atopic dermatitis, psoriasis, psychogenic excoriation, urticaria. Then the muscular system including rheumatoid arthritis, SLE, fibromyalgia. Then seventh, headache, maybe migraine or tension type. So these are the important conditions. Now in hysteria, the defense mechanism used is, it is dissociation, wherein the person is able to separate self from the surroundings and splitting of the one or two mental functions from rest of the other mental functions. So the answer is dissociation. Now coming to question 190, the sensate focus technique is useful for sexual disorder. Important to remember, the Master and Johnson gave 3 stages for basic principle for 3 stages for the sexual dysfunctions. These include non-sensate, non-genital, sensate focus. Here it helps to establish physical intimacy. Then there is genital sensate focus. Here it facilitates sexual arousing. Then third is the vaginal containment. It is the part which is just before having a full sexual intercourse. So genital containment. Now also other various important treatment, especially for premature ejaculation. 2 important technique is please you should remember the name, stop start technique given by Siemens, and the squeeze technique given by Masters and Johnson. Now in severe mental retardation, as we already discussed, the IQ is 20 to 34. Now child of 10-year-old present with hyperactive inattention, parents are advised, extremely worried. So what you should say, that you should, the likely diagnosis may be ADHD, and you should say that it's a serious, option C, it's a serious problem, and medical therapy, as we discussed, is the treatment of choice. Now Ratan, a middle-aged man, is chronically ill, preoccupied with his health. For many years he fears he is having irritable bowel functions, meant he had cancer. So he reporting that he may have cancer, a serious illness. Now he is preoccupied with having a serious heart disease. Now again a serious illness, despite the physician's assurance that it's just an occasional heartbeat and completely benign. So the correct answer in this case, as we had discussed, is answer C, that is hypochondriasis. Now let us discuss important thing about type A personality, falses. So the correct answer is option D. So 194. Now type A personality, it was described that Mayer, Friedman and Mike Jordan, they described the type A personality, there is an increased risk of heart disease. Now some of the important characteristics. Characteristics of type A personality include time urgency and impatience, then free floating aggressive behavior, aggressiveness and hostility, then competitiveness, then strong achievement orientation may be seen. Then there may be some physical characteristics. Physical characteristics may be seen like facial tension, tongue clenching, then there may be dark circles, some of the important, and facial sweating. So these may be seen in persons with type A personality. So there is no mood fluctuation generally not seen. Now which of the following is the new entity? Is not the new entity. So olfactory reference disorder, mild cognitive disorder, complex post-traumatic stress disorder, and attitude. So the correct answer is option D, attenuated psychosis syndrome. In fact, it's a new entity which was added in DSM-5. So let us see important regarding ICD-11. Its advanced review is out and expected that a final is launched by 2021. So now let us see what are the major changes. Now it is characterized under chapter 6, mental illnesses, as mental, behavioral or neurodevelopmental disorders. Under these the psychiatric illnesses are characterized. Now there are certain disorders or diseases which are now coded elsewhere. That is, previously they were in the psychiatric part, but now they are like sleep-wake disorders, then sexual dysfunction and gender incongruence. These are now they are coded elsewhere. And also there is exclusion of acute stress reaction. It is excluded from this chapter, chapter 6. Now few important major new changes. Let us discuss. New changes are in schizophrenia. there is removal of the subtypes. In mood disorders, there is addition of bipolar type 1 and 2 disorder, which was not present in ICD-10. Then in now again similar to DSM-5, now obsessive compulsive or related disorder has been added as an entity, and various disorders which are in this are OCD. Also there are specifiers which says now various disorders added are OCD with, and also there specifies in which says about the insight, that is fair to good insight and poor to absent insight. So this has been added. Then similar to DSM-5, body dysmorphic disorder has been added here. Then hypochondriasis has been added there. Hoarding disorder has been added there. Then there is also, fifth is the olfactory reference syndrome, that is again added here. Then there is a new entity, body focused repetitive behavior has been added, which includes trichotillomania and excoriation. So a lot of changes have been made in concordance with the DSM-5. Subsequently, there is a new complex post-traumatic stress disorder has been added. Is a new entity which is added in the list. Then more severe form, that is even more severe form than the PTSD, so it's a more complex. Then in feeding disorders, new terms added are the binge eating disorder, then the avoidant restrictive food intake disorder, then rumination, regurgitation disorder. Then another important added is the body distress disorders. Then there is gaming disorder has been added, important. It is added in the disorders due to addictive behaviors. Then in impulse control disorders, new additions are the compulsive sexual behavior disorders and the intermittent explosive disorder, which is also was added in DSM-5. So this is a new entrant. Then other than personality disorder, even the predominant personality traits and patterns has also been added. That is not up to the level of disorder, but even few traits that has been recognized. Then there is addition of factitious disorders, and in the there is an addition of neurocognitive disorder, the term which was also used by DSM-5, in which this includes delirium, mild neurocognitive disorder and amnestic disorders. So these are some of the important changes which are done in ICD-11. Now answer to question this, as we all know, is answer is thematic apperception test. So question 6 is the option D, that is thematic apperception test. Now this is a projective test. Now this is based on the principle that a vague or an ambiguous stimulus, the person, if we describe that ambiguous stimulus, may reflects unconscious conflicts. Now thematic apperception test was given by Murray and Morgan. Now it basically has 31 cards, 30 cards which depict IPR, interpersonal events, and one is a blank card. So 30 may be the answer if that is in the option, that the 30 cards placed. Now basically the person is asked to write a story that what happened before this event, which is in the photo or in the card, then what is actually happening here, who are the people, what are their emotions, and what is going to occur in the future. So the person is asked to write a short quick story, and according to it, it is interpreted and subsequently analyzed. Now other projective tests includes this is one of the tests. So the other tests include the Rorschach test. Then important is the draw a person test. Then fourth is the sentence completion test. Now other than the objective test, other than projective test, there are also the objective test for personality assessment. So these are also known as the pencil and paper test. Now some of them includes questionnaires, then MMPI, that is the Minnesota Multiphasic Personality Inventory. It is of 1 and 2. Then it may be the California Psychological Inventory. It may be some of the objective tests may be this. Now coming to the Halstead written battery involvement, all except, so the correct answer here is option B. Constructional praxis is not in this. So let us see the various tests to assess organic conditions. First is the Halstead written test. As you may read in the answers given along, that constructional apraxis is it does not include constructional apraxis but includes other 9 domains. So there is a Halstead written test. Then other test for organic condition is the Bender Gestalt test. Then third is the Lubria Nebraska test, and fourth is the Ames or the PGI battery. These are some of the tests which are used to assess the organic conditions. Now again 188 is a recently asked question. So adverse effects of acetaldehyde are all except. So it leads to sexual side effects like anorgasmia. Then there are GI side effects including decreased appetite, nausea, diarrhea, constipation, but there is dry mouth. So there is not excessive salivation but dry mouth. There are also vivid dreams seen. Then there may be autonomic side effects like sweating. There may be life-threatening side effects of acetalopram like seizure, which is again rare. It may lead to suicidal ideations or may even switch to manias, but these are rarer life-threatening side effects. So the correct answer for 1898 is option B. Now coming to the next question, now the drug approved for psychosis in Parkinson disease. Now again important question, maybe a prospective new question. 199, the correct answer is B, that is pimavanserin. So now this is a 5-HT 2A, as from the name it is serotonin is involved, 5-HT2A inverse agonist. Now it is the first drug which is being approved for psychosis in Parkinson's disease. Now the other option, valbenazine. Now it is a FDA approved drug, first FDA approved drug for treatment of tardive dyskinesia. Now mechanism of action includes, it is a reversible inhibitor of VMAT, that is the vesicular monoamine transporter 2. So it basically leads to inhibition of this, leads to depletion of monoamine in the synaptic cleft. Now another important option, lurasidone. Now it was FDA approved in 2010 for schizophrenia and 2013 for bipolar depression. Now it has affinity for D2 and 5-HT D2 and 5-HT2A receptors, and also it has affinity for 5-HT7, 5-HT1A and alpha 2C. Because of this, it is pro-cognitive, antidepressant action it has, and anxiolytic. So this was about lurasidone. Again, important questions. Now question, again a recently asked question: who gave the hypothesis patients of mania treated with undergo remission and on withdrawal mania recur? So this was given by John Cade. In fact, the full name is John F.J. Cade. So let us discuss briefly about lithium. Now lithium is the third simplest element in the periodic table. Then the first, it was first isolated by Humphrey Davy. Then it was Carl Lang who first time systematically employed it in treatment of acute and long-term treatment of depression. But then subsequently it was withdrawn from the market, from the US market, but it was again John F.J. Cade who reported it. He is an Australian psychiatrist who said that there is no ethical contraindication to use lithium, and also in fact said that in withdrawal the mania may recur. So it is important to remember, both of them important to remember in terms of lithium. Now FDA, it is approved by FDA. Lithium is approved by FDA for acute mania as well as maintenance in patients with history of mania. Now T-half of lithium varies from 18 to 24 hours. Now let us just discuss in briefly various adverse reactions of lithium. There may be neurological in the form of tremors. In thyroid, it may be hypothyroidism more than hyperthyroidism. Then serious side effects may be heart block, then bradyarrhythmias may be seen, then QTC prolongation, T-wave inversion, then renal, maybe polyuria, or even non-specific interstitial fibrosis may be seen. Then there may be other, including weight gain. Then dermatological side effects may be acne, psoriasis, rashes, hair loss may be seen. Now if used in pregnancy, it has a teratogenic effect. It may cause Epstein anomaly. This may be seen.